Hi everyone, Dr. Erik here from MedBetter Health. And as you know, we are very, very dedicated to telepsychiatry and mental health. And today I'm going to have a discussion with someone who's incredible, is a rock star, and really knows about mental health, our very own nurse practitioner, Luz Rodriguez. Welcome.
Thank you for having me.
So Luz, you are a PMHNP. What is that? What's a PMHNP?
That's a psych mental health nurse practitioner.
Uh-huh. And you know, Luz, so you specialize in mental health.
Yes.
When I look at mental health, there's a couple of ways I look at it. I look like if someone who's listening right now, they have depression, or someone who's listening has anxiety. Very often, it's very hard to get to a visit. To get an appointment is super difficult. That's number one. Number two, when you do get an appointment, people are very quick just to medicate you without finding out what the root of the problem is through talk therapy. Yeah. The issue with that is that when you are taking medications, you don't know what the side effect profile of those meds are.
Absolutely.
Right?
Absolutely.
So yes, it's a process, but it could be a very healthy one. Like, to be honest, I've seen what you do and other of our team members, what they do, which is, you speak to somebody, you identify a problem, you identify the root of the problem.
Correct.
And then you have a goal and an objective.
Absolutely.
And frequent touch points where you're holding someone's hand, right?
Yes.
And you're saying, look, you're not happy at work. Oh, you're depressed. Here's a medication. No, you're happy at work. What caused it? Oh, you're getting bullied at work. People are making fun of you at work. Okay, well, let's look into that. How can we change that? Is the workplace the right place for you to be? Can I help you even think about making a resume and looking at your resume and seeing you could look for a different position?
Correct.
I'm not just going to medicate you.
Right.
And I know that you told me yesterday you had a case.
Yes.
Tell us a little bit about that case, because I was like blown away by what you did.
Basically, my patient had problems with focusing and concentrating on schoolwork. We talked about, what exactly was, causing her to, or causing this individual to not be able to focus. And as she continued to tell me her story, she had mentioned that at one time they had given her a diagnosis of ADHD, and we explored that a little bit because
so she was diagnosed by someone else as having ADHD.
Yes, she was diagnosed with this. However, after we talked about it, and ADHD is a diagnosis that you give, but not just immediately. It's not given immediately. It's after several conversations that you have with them, because there's different things that you have to explore.
And what is ADHD for some folks who may not know?
Attention deficit hyperactive disorder.
And how do you feel when you have that?
And basically, you cannot focus. There's things that you're not able to do. You're not able to keep a plan in place, or there's things that you cannot keep in alignment, like you're not able to you're not able to do your homework, say, for instance. You tend to have, you're paying attention and you're doing your homework, and all of a sudden your mind just wanders and it goes somewhere else. Or it could be that maybe you're not organized at home and you're not able to keep your thoughts focused on one specific thing. So basically that was the presentation. However, as we continue to talk and as I continue to explore the focus, she started mentioning.
Let me ask you, you didn't just, and sorry to interrupt, you weren't like, oh, someone else diagnosed you with ADHD. Let me keep it simple for myself. What are you taking? Oh, you're taking 15 milligrams? Let me increase it to 30.
Exactly.
You didn't do that?
No, I did not. Because when she mentioned this to me, I asked her, I says, well, are you taking medications? And she mentioned no. So I started going down the road in terms of asking her, when were you diagnosed with this? Were you just seen one time? Were you seen twice? And according to the conversation, basically it came down to there was other situations going on with her. I asked her about her previous mental health condition. It's important to ascertain if there are other conditions going on. And after exploring that, I found that some of the situations that she had been dealing with in previous, occasions could also cause her not to have focus. It could also cause her not to be able to pay attention to certain details.
So was it ADHD or something else?
It was something else. After our conversation, we found that, at least based on what she told me, she didn't fit the ADHD
criteria.
diagnosis. She did not fit that criteria at all. if anything, a lot of what she was going through in terms of her life led me to believe that it was more anxiousness, depression, and more depression probably leading to more anxiety. So
Which is a very different treatment.
Absolutely.
So most likely that's why that individual was reaching out to people trying to get help. They diagnosed her with ADHD, giving her treatment for it, and it wasn't working.
Correct.
Because it wasn't the right treatment for the right medication. And it wasn't the right medication because it wasn't the right diagnosis.
Correct. So it's important that whenever you have a patient, they give you, this is the diagnosis I have, to explore that, to make sure that that individual or that person has that diagnosis, because it does affect your treatment. It also affects how you speak with them as far as therapeutically. So what we did is we started exploring those particular areas in her life that were not going well. And then we started talking about possible solutions, possibly looking at things from a different perspective. But at the same time, we talked about, because she was more interested in maybe some medication because she needed a solution for this. But as I explored this with her and I explained why I felt she did not have this particular condition and why I felt she had something else, she started opening up more and telling me about medications that she might have been on before, other mental health conditions that she was diagnosed with before. And then we found that she had abruptly stopped a certain medication she was taking for a condition.
So again, sorry to interrupt. It seems like you needed to spend a good amount of time getting deep into the problem.
Exactly.
And it took some time. It took some effort.
It did. It took a lot of time for us to get to that point. But eventually we got to the point where she had stopped taking her medication. She was feeling anxiousness. And of course, if you've been someone that's been on medication for some time now to control depression, anxiety, when you abruptly stop anything, then it could cause certain symptoms. And the symptoms that she was experiencing was related to that.
Mm-hmm.
So what we did is, based on what her information was to me, we explored a different category of medication, but we also talked about the things that she can do in her life to kind of organize it a little bit. And I also felt that by also stabilizing her.
Initial time you saw her was like a month ago?
Yes, it was about a month ago.
And that's when you identified it?
Yes, I identified that. And I wanted to follow up with her, and I told her, I says, this is going to be our plan. I says, this is what we're going to look at. I want to talk to you about potential solutions or medications that we might be able to give you. But the purpose for those medications are for these reasons. And I explained to her, this is what it will help her do. One, it will help her with focus, but it will also help her with some depression, because at that point, I had already screened her for anxiety and depression and found that she was at a higher level of those, and found that this particular medication worked well. And I said, let's try this. I said, it's going to help you with focus, because her main purpose to speak with me was because of focus. So making sure that she understood it's going to help you with your chief complaint, I guess, your main reason for seeing me. I said, but it may also help you with the other areas that you're dealing with, the other emotions that you're having. I said, we'll touch base in about a week or so, just to see how you're doing. And then you tell me how you're. I says, now, therapeutically, of course, there's a certain time frame that you give people on medications because it's not immediately going to help. There's a therapeutic range. However, you will feel a difference. So we planned on meeting with each other 2 weeks out, just to make sure that, that things are going well for her. And I had the opportunity to meet with her about 3 weeks into it. And she was totally changed. She told me how happy she was and how she felt and how she was able to focus, how she was able, she did not feel the anxiousness that she felt. Certain circumstances when they came to her, like her schoolwork, she felt that she had accomplished things. She was able to focus, finish her homework, and immediately she felt a sense of accomplishment. And I noticed with her that she was able to give herself praise for what she had done. And a lot of times I use what they call motivational interviewing, and it's a process that we do, and we talk about what's really going on. We talk about things that are going on in your life, but it takes a certain level of listening. You have to listen to your patient. And what she had mentioned to me is that she was feeling very happy because she felt a sense of accomplishment. She was able to actually focus on her schoolwork, which was important to her, but also all the other aspects of her life, the anxiousness that she felt, the depressive feelings that she was having. They no longer, she had some, but not to the extreme that they were the day that we met. So we were on the right path. We were going in the right path. She was happy with what she was taking. She was happy with our conversations, the fact that, we took the time. And then we also came up with, okay, this week, this is what our plan is.
So you set specific goals.
So when we meet again, this is what we're going to focus on, and this is what we're doing. And this is what I would like for you to try to do whenever you're doing this, to focus on what are the areas of your life that you might have improved on. Give yourself praise for those. It's very important that you give praise to yourself whenever you accomplish certain goals, because it tells you that you are doing your due diligence, that you have taken a step in the right direction. And it's important. Together, we can accomplish these things together, but it's all about how it is that you're feeling at the time, your perspective on life, and seeing things from a different perspective. I asked her, whenever these things happen, I want you to sit back and reflect. Sit back and reflect on those moments, and then look at what are the areas that you have improved upon, and then look at where you were versus where you are now.
Wow.
And then take that and then say, you know what, I can do better. And then eventually you'll get to a place where you want to be. And that's how I take care of my patients.
That's such an incredible story. And we're very blessed here at MedBetter Health to have Luz with us and to help people in this way, to help change people's lives.
Absolutely.
Because think about the impact. This individual, this young lady, she couldn't function. She couldn't grow in life. She couldn't accomplish her goals because, she wasn't diagnosed the right way.
Right.
And then you come in and you actually spend the time. And that's where a lot of people in life don't want to do, like, oh, here's a quick fix. But you went in, you did a thorough analysis, you did motivational interviewing,
right,
and cognitive behavioral therapy. And now that individual can function.
Yes.
Now she could be happy.
Yes.
And you're sitting here right now, you're talking to me,
Yes.
but that individual is there now, a changed individual and
Yes.
a happy individual.
Yes.
Because of the impact that you did. Now her relationship with her mom and dad is going to be a happier one. Her relationship with her boyfriend or husband is going to be a happy. Why? Because her whole inside now is a different individual.
Correct.
Because you got to the root of the problem. And
Correct.
so we're very, very blessed to have you on the team. And for the folks who are interested in seeing you, it's very easy. It's on our website. You can find a picture of Luz, click on the Book Now button, and you'll be able to book an appointment with Luz. I pride myself, on having the right team members, because I know that the impact you can have to so
Yes.
many different people. And me as someone who runs the organization, it's a big responsibility to have the right people in the right seats. And obviously, as you hear the conversation today, you see the experience, the knowledge, the expertise that you, Luz, have. So thank you so much for
Absolutely.
everything that you do. You're doing incredible work. You're doing God's work. And we are blessed to have you on the team.
Thank you for having me. Thank you.
Thank you. Thank you.